patients pass through our care, and it goes into the cardiologist, and the ICU, and the hospital docs, and we oftentimes, as sort of the air traffic controllers, the plane takes off or lands, or
don't see it again.
We don't see it, and so for our folks here to know what a role they play, real folks out there doing their life things after being cared for by us, that's the ultimate form of, for me, rejuvenation and put meaning behind what we do. So for all of our people in the room, thank y'all for that. And thank you to the Bulls for being here with us. Just a little bit about the case for those of y'all that don't know, and I'll speak freely if that's okay.
Absolutely.
Mr. Hoyle has a condition called Situs Inversus, and that's where all of the internal organs are flipped. So the liver's on the left. It's kind of weird. It's usually on the right. The spleen's on the right now. That also puts the heart on the right. Thankfully, he knew that. Sometimes folks can have this condition and not know it. Usually, some point in life, you get an X-ray, you get something done where it's found. Every now and then, we'll find it randomly in the ER. Having everything flipped is much, much, much rarer than just having the heart flipped, which is called dextrocardia. That's rare, but more common for sure than full situs inversus. And the excellent part from our standpoint, from the EMS standpoint, is that number one, we listen to the patient. Oftentimes, patients bring us information, and in our haste and rush and desire to get all our normal things done, we don't always have our ears open, because oftentimes that history can tell us everything that we need and then some. And so the medic crew on the truck said, "Oh, everything flipped, huh?" Which means the EKG leads have to be flipped. And I don't know that, it seems, looking back, like, oh yeah, we should have done that. But how many times have y'all put EKG leads V1 through V6 the opposite direction in your career? I've never done it. Never done it once. So the real lesson to me, beyond the medical jargon and terms like situs inversus and flipping EKG leads, for everyone in this room, no matter what level you are, is that we always got to listen to our patients. Because sometimes they'll give us the key, and they did. And we listened, we acted on it, and then we saw the changes. It doesn't matter where your heart is. I shouldn't say that. If you put the EKG leads on appropriately, a heart attack's going to look like a heart attack, which it did. And, besides all the hurdles we had to cross, we were able to still say, hey, this is a heart attack, and alert the cardiologist and the cardiology team at the hospital and the emergency docs. And I wasn't there that day. I would have jumped up and down with excitement. I'm kind of jealous that I wasn't there. But the really excellent part, we talked a lot about over the last month, systems of care here in the county, and to have, from the time of dispatch for our dispatcher all the way through to our fire partners, to our EMS crews, to the hospital cardiologists really delivering excellent care, getting the stent in, and really having to troubleshoot, because plumbing is normally pointed a certain direction, and when it's opposite, the tools don't even work, as you guys found out.
Right.
But thankfully, we were able to pass the tools deep enough, figure out where the blockage was, open it up, and even there on the cath lab table, your status improved drastically. And so the cardiologist said, well, we're good for now. So I am interested to figure out where now has led, because there was some testing scheduled after y'all left, so I don't know if that's gotten done, but I did want to ask y'all about that. But not to talk anymore. It's really awesome to be able to reunite and to share the good stories, because so many times I think we dwell on the bad ones, and we have to balance our scales in this job. And so this today for us, thank you all for coming. It helps us balance our scales.
Well, thanks to y'all.
What we do matters.
We're
able to be here.
Yeah, it's definitely a win-win when we can make these work out. And so I won't talk anymore. I'll let you guys chit-chat. And we get to do pictures.
Yeah, if you want to bring up Mr. Hoyle, and if he has something to say up the front,
Sure,
do you mind, Mr. Hoyle?
Short.
So my biggest thing is I wanted to meet y'all. Y'all saved my life. And I said I wasn't going to do this. She said she was going to do it. I don't really know what to say. I just found out about this situs inversus when I was 32 years old or something. Growing up and playing sports, I never knew anything about it. But never had any heart issues. never had cholesterol issues, blood pressure issues, nothing. So this was kind of out of the blue. And it has changed my mind. I do now have medical charm. I had a bracelet, but we did a test run at a friend of mine is a senior captain in Houston, and we went to his firehouse and tested his paramedics. They never even saw the bracelet. So I went ahead and got the charm, and it just says my name, Situs Inversus, true Situs Inversus, and it says EKG reverse. So, and then on the back it says that I'm diabetic, I'm on blood thinners now, heart patient. But being able, the fact that you guys listened, I've had physicals done before and they didn't listen and it doesn't come out right. Come to find out when we went to my friend's firehouse, when you hook it up normal, quote unquote normal, it shows I'm in AFib. So, and just like right now, if you hooked it up to me, it would show that I'm in AFib and I'm not, you know. So then once they hooked it up, and we let it sit for a while, normal, and we were sitting there talking about it, and all of a sudden, I guess your machines, if it senses something wrong, it'll start printing on its own, saying, hey, something's wrong, and at that point it said I was having a STEMI. So I was in STEMI, I don't know the term, but so, and I mean, I wasn't, I mean, you know, so they're like, oh, let's hook it up right real quick and check and make sure you're good, you know, and I was, but the fact that you guys listened to us saved time, and, you know, I didn't know nothing about heart attacks really, so when the doctor told me I had 90 minutes from the time the heart attack started to the time I got treatment, meaning stents or whatever, 90 minutes is not a long time. And especially when you think about, to me, I was thinking, well, that's when you first call 911 and they're coming because something's wrong. That's when my time started, so it saved time, and I appreciate it. You guys are doing an amazing job, and I'll tell you, you saved my life. You know, saved a lot. And my kids, all when they came out, they have kids all over. We have kids in California and Wisconsin. My mom from Idaho. They all came and thought they were saying goodbye. So, because of what you guys did, and the accuracy and the speed that you guys worked at, I'm able to stand here and thank you. Thank you.
We got awards for our people, and then we've got these plaques. One for the firehouse, one for our house, and one for your house. They'll have a group picture that you'll take care of for everybody. Okay? It's got everybody's names on there. So I'll start with our fire partners, Alex and Corey, Alex Rolson and Corey Brown. We're the fire crew that day. They're part of North County Fire. They kick proverbial butt every single day for us up on the north side. Y'all know that it might be meetings running on one day too. So you guys got to stay sharp.
Oh, yeah, or I can take it for you and you can be in the picture.
That was pretty cool.
Was this the third one of these y'all seen? Third, fourth one?
Yeah. Of course, this week.
1, 2, 3. Awesome. And you'll hang out. We'll do a big group picture in a second. Okay.
All right, and then our MCHT EMS crew, Nicholas Nellis and Jason Jones.
He wouldn't let my wife come with me, and he was driving too slow. According to me at the time.
Yeah. I think we got to hear from you, Jason.
Oh, we do?
There's Situs Inversus, which is all your organs are switched, which your heart's normal. True is where everything and the heart. But so what I have is actually 1 in a million people are born with it, is what I've been told by all the doctors. So it's pretty rare.
So you said that you played sports in school, so that shows you how bad sports physicals are. If they've ever been.
Well, I mean,
But you don't do
honestly, that's
x-rays.
what I
You don't
thought.
even do
Well,
a chest
If
x-ray
you
in
lift,
sports.
Yeah.
if you listened on this side,
You'd still hear it.
you still hear it. wouldn't probably be as strong, but you probably just wouldn't even think anything of it,
The
but.
person, I'd say, do you feel okay? Yep. You ever have any shakes?
Yeah.
Nope, and I go through the motions and move on.
Keep on, yeah.
But
So,
yes.
the way I found out was through a CAT scan when my gallbladder almost exploded, and I had a CAT scan, and that tech freaked out.
Yeah.
He didn't know what he was looking at. Yeah.
He told you to flip over?
Yeah, right?
Yeah, well, he came in and checked his film a few times for that magnet to make sure it was right.
Yeah, so it started basically.
Hang on, just
Main fire was pulling up at about the same time we did. Is even looking out of the window of the ambulance, I could see him, and I was like, oh, he's not the right color. He is just gray color. I was like, that's not good. And then as soon as we got up to him, it was warm outside, probably 80,
Yeah, it was-
85, and he was ice cold, sweaty. Like it was pretty easy to pick up that something significant was going on. He's like, hey, I've got Situs Inversus, and I think you were standing behind me.
Yeah.
Like, hey, he's got Situs Inversus.
You gotta
So I'm
hook
like,
it up
okay.
backwards, yeah.
I knew that I had my best friend in high school, his sister had Situs Inversus, and she had everything flipped as well. It's the reason I'd heard of it before. And I asked, is everything flipped? Is it just, sometimes it's like you said, just organs, is it true Situs Inversus with an extracardia, where everything's flipped, heart, lungs, all your abdominal organs, everything. He said it's true Situs Inversus, everything's flipped. So, okay, we need to move all these leads. And it took forever to get the EKG because you were so sweaty. We had to put the benzoin on and
Yeah.
put the leads around and did the EKG backwards. And I was like, oh, we need to move quick. This is STEMI. And took one of the, I don't remember which one, I took one of you guys with me. And we were just on the road. Limited our scene time as short as we could. And tried to get your pain under control as best we could. And it wasn't much. I mean, we gave it a little bit of fentanyl, but
Yeah,
you were still hurting pretty good when we got to the hospital.
yeah. I was hurting all the way up, whatever they gave me in the ER, calmed me down where I wasn't shaking so bad. I could still feel the pain as bad as it was, but I wasn't reacting to it. And I remember being on the cath lab table, and I figured I would feel something. I didn't feel anything at all. And then we were talking, and all of a sudden, as we were talking, I thought, hey, the pain's gone. It was just that as quick as it started.
And he was like, do you feel better? And he was like, yeah, it's gone.
Yeah.
Yeah, we were standing in the cath lab room. We got to watch the whole procedure. And he's like, this stuff's all made for a left heart because I have to turn my hand. Even the doctor was like, I have to turn my hand a different way to find the vasculature.
Yeah. And he wasn't able to find the right side
Yeah, he
artery.
couldn't find the right coronary.
So, yeah, that was kind of scary. But now, come to find out, he called around after all this to see if any cardiologists had any experience so he could kind of get some feedback on what was going on. And he could not find a cardiologist from Huntsville to Houston that had ever been inside a heart like mine. So I'm like, well, you're the expert now. They're going to be calling you.
Which doctor, John, working with over there?
Dr. Romanini. And luckily, my insurance, so I'm able to see him outside of being in the hospital. So that's great because I don't have to go through all this with another cardiologist and try to get him caught up. I can stay with Dr. Romanini. I had the CAT scan done, so
Right side clear?
25% was all it was. So he said, I'm not even going to worry about it. So we're going to keep an eye on it. I've got another echocardiogram coming, I think, next month. This way he's got it all. Not only does we found out there was only 25% blockage, but that CAT scan also showed him where that artery goes out. So now he can do his calculations or whatever. He knows what cath he can use if we ever have to go back in.
That's good.
So that was sort of where the cardiologist stopped for everybody else in the room. The blockage was in the left anterior descending coronary artery, which fit the EKG picture because the EKG picture was an anteroseptal MI. So going back to our baseline test, sort of question which artery is affected. It was B1 through B4 for Jason, and so it actually matched, thankfully, somehow. I was like, that's lucky, because if it had been in the RCA, he wouldn't have been able to get to it. So that's when your pain went away. I could almost guarantee it's probably when the stent was deployed, or at least shortly
It was a
thereafter.
balloon.
And then the cardiologist did his notes, basically said I couldn't pass it, but the patient was doing better, so we'll hit pause, take him to the ICU, and let things settle. And they all settled out. I think you were in the hospital 3 days.
So I went in Friday, and then I was out Monday afternoon.
Yeah, so just over the
In
weekend.
ICU for 2 days, and then the regular room for Sunday afternoon they put me in there, and then Monday opened
the smart part about it from my standpoint was saying, using a different, this is not different than what we do sometimes. When our normal pathways don't work, we have to think fast and troubleshoot. Cardiologist said, okay, I can't see the right side with my normal, but he's stable, let's come back on another day. We always don't get another day in our world, but in another modality and use the CAT scan calcium score to look at the right side. So while it's not as accurate as the cath, if you can't get it, it's the next best. And so I would be pretty comfortable sleeping at night with 25%, knowing you've got to quantify your risk factors. I'm sure Dr. Ramirez giving you that speech. I'm not going to give you that speech.
I give them the speech.
Good.
Yeah, I told him, I said, great, I was already diabetic. I said, so now I've cut down all these foods I can't eat. The foods I can eat, now I have to eat with no flavor.
They all spit it out.
Well, that's good news. So you're now just cruising.
Cruising, I'm doing good. I've been doing cardiac rehab, and that's going great. And back to work. In fact, I was back to work in 2 weeks.
Yeah,
That was
going
2 weeks
on
after
the third week, yeah.
Yeah, going into my third week after I went back to work. I work for the city of Conroe actually, so drive a dump truck. So my guys, they even still are my crew leader. The first like 2 weeks I was there, I'd go grab a shovel, they'd come take it from me. I'd go grab a broom, they'd come take it from me, you know. And I'd get out of my truck with my gloves in my hand. They're like, "What do you need those for? You ain't doing nothing," you know. So.
I bet you're kicking butt in rehab. I bet you can beat all those other folks.
Yeah, 'cause he's the youngest.
Pretty young in there.
Yeah.
You know, I don't feel like, I'm 50. I just turned 50 last September, so I know to a lot of the people that are in there, I'm young compared to some of the guys in there, or some of the people in there. But and it's weird, you know, because now I don't feel, except for I still get tired pretty easy. I can go a lot longer now before I start, but when I get tired, it's like right now. It's not like, I'm kind of tired, I should probably go lay down. No, it's like, no, I need to lay down like right now. So every once in a while I'll get a little dizzy spell or whatever, but.
Keep doing your rehab, that tiredness.
Yeah, and I'm pretty active during the day. I mean, I say I drive a truck, but I'm on an asphalt repair crew, so we're constantly out, and we're shoveling or raking or doing something, so I move around a lot. I'm not just kind of sitting doing nothing, so. But Doc just said, you can go back to work if you want to, you just gotta listen to your body. And your body says, sit down, sit down. He said, because if you don't, your body will sit you down. He said, you learn that quick, so. Yeah, especially not knowing, I never had any issues with my heart, so. There's heart disease in my family, but it's a grandma on one side and a great-grandmother on the other side, so it's not real close to me yet, so I never really thought about it, And I always thought I was eating pretty healthy with being diabetic. I cheat here and there, but, but I was the first one to say, when we got to a Mexican restaurant, dump all that salt on them chips and, all my seasonings that we use when we cook, and, so. But we found a bunch of places online, companies that are either no sodium or low sodium seasonings. So we bought, 10 or 12 of them. And
I'm learning how to cook.
we just have to use a lot more of them. We're learning, when we first started, it was like, man, this is really bland, and that's with the seasoning, but you just have to use more of it. But yeah, I'm doing really well. I feel good.
You look good.
Thank you. I know I probably look better than the first time you were there.
Amazing what happened.
And then, the scary part was, when it started, I was actually at work when it started. We got called in for a tree down, and I thought it was heartburn. And then I left work, and I drove back up to the Legion. She was up there playing bingo, and I drove back up there, got a little worse. I asked her for some Tums. She gave me some. I ate them. About 5 minutes later, I was just like, oh, man, what is going on? This heartburn. So I said, I think I'm going to get sick. I went in the bathroom. As soon as I got in the bathroom, it hit. It took me to my knees. Instantly started pouring sweat. Got that weird tingling feeling from my armpits down both insides of my arms. And I was like, oh, okay, there's something else going on here. So that's when our son came in and asked if I was okay. And I said, no, something's wrong. Go get your mom. Tell her to meet me out back. And so when she came out and asked, and she said, can you feel it in your back? I said, I feel it in my toes. It hurts so bad. Now, when I said the tingling going from my pits to my hands on both sides, she was like, nope, call 911. Y'all to the rescue.
So we can't get through the day without a lesson here. You know, somebody tell me, when we think about chest pain, cardiac chest pain, what arm do we always think about?
Left.
Yeah, it's actually much more predictive when it's both arms. So if a patient ever tells you it's both shoulders or both arms, that like takes the left arm and multiplies it. So both shoulders, both arms, not that that should ever rule in or rule out, as you know, it would be all kinds of different ways that cardiac chest pain presents. But the both shoulders, both arms is actually a huge warning sign.
See, that's a question I had actually asked a doctor back when I found out, and I was kind of learning about this. I'm like, so when somebody's having a heart attack, they usually complain about pain in the left arm. I said, so with my heart being opposite, will it be in the right? You know?
Yours would be in the textbook, but actually in people, when they say the left arm is predictive, but
Right.
both arms is actually more.
Right, and then, so I didn't have a choice. They went to both arms.
Yeah, so you're lucky. If you'd have told somebody who read the book it was your right arm, they'd be like, oh, that's fine.
You're good.
See, and
Yeah, you're good.
also that's why when I found this about this, my gallbladder was enlarged and they were going to remove it, and they came and told me, they were like, look, there's nothing wrong with your appendix, but if you were to ever go into a hospital with lower right abdominal, lower left abdominal pain,
Elements there.
they are not going to think appendix, and that could be crucial for you. So they went ahead and took my appendix out when I had that gallbladder surgery as well.
Not surprised.
That way, the risk isn't there, you know. But I was like, yeah, what else is in there I don't need? Just take it out. But yeah, but again, I appreciate y'all that. I mean, that was the scariest thing. I've been through a lot of scary things in my life, but nothing like that.
Well, we can be there. It's not every day we get feedback on all of our patients. We don't always know the outcome, like he said. Sometimes they're whisked away to the ICU, and we never hear what happened. But thank you for coming in and meeting with us. And
Absolutely, I appreciate
kind of
that.
sharing your story.
Thankful I'm able to be here to do it. And I know when he called and talked to me about a week or so after this, I got out of the hospital, and he's like, don't want it to sound like I'm weird or anything, but I'm kind of stalking your case a little bit. And I'm like, that's all right. And we're so big on, like, that's why we went to my friend, who's a captain in Houston. We went to his firehouse and talked to his paramedics and a couple of the firemen and stuff there. They actually hooked me up to an EKG, regular, quote unquote normal, and then normal for me, so they could see the difference. And we got to talk about it, and you know, I know it's something like everybody's been saying. We read about it, but we've never seen it, and now it's out there. There's somebody around where, you know, that could save some, especially these guys that might not even know. I mean, I didn't know until I was 30-something years old, you know.
So what we would like to do, and you know, I think it's just a reflection on us as a service, just kind of the next step on those lines. We'd like to try to take your case and write up what we call a case report. In medical evidence, there was a case report for the first AIDS case, for example. Sometimes very big things start with very small, singular case reports, and this is one that there's not going to be more than 1 in a million, because that's what it is, but we would like to put it out there into the EMS world with people that teach and talk and think about this, so that it can generate that discussion, just like you're talking about. And that way that somebody, hey, I heard about that, or read about that, or, you know, the more we can make people aware. It's as simple as moving the leads, but it's not.
Don't forget to use the arm leads as well.
It's easier said than done, everything.
Yeah, the top ones.
Yeah, I mean, limb leads have to go 2 other lots. It's just the 3/4 everything has to go.
It was interesting. We did a search looking for a case similar to yours to see if there was any documented evidence of anybody ever having that interaction with EMS. The EMS interaction with a patient with true sinus inversus and a STEMI, and there's none exist.
So there'll be one, hopefully.
Dr. Romanini said that they don't even make the casts for the other side. Like, because I was like, he's like, there's not even.
That's why he said, knowing where that artery goes out, now that he knows, he just has to do his calculations, then he'll know which cath he would have to use, should he ever have to go into that side.
But they don't even make them.
Yeah,
He was even speechless. He's like, this is a once in a, like in 10 careers. The cardiologist.
He said in 16 years, like I said, he read about it, but never seen it in person, so. I told him, I said, you're the expert now. I said, you need to learn, you better learn, because I'm gonna be your little puppy dog now, because, man, I tell you,
They've got a new case.
I love that dude, man. He's got my heart in his hand, literally. So,
Doc, what percentage of the population is actually afflicted with this, basically?
I mean, yeah, I mean, 1 in a million is what I've seen, and you know, it's all coming from the same textbook. So, I mean, it's one of those things that you learn about in, I guess, the second year of med school, that it exists. There's some other comorbidities that it sounds like you don't have that can go with it sometimes. But yeah, 1 in a million. So there's.
And then to be having a STEMI on top of the 1 in a million is even more rare.
That's the real amazing part about it. When you say 1 in a million, that's just that Mr. Hoyle's walking around. Now he's got to have a heart attack and be tended to by our medics here in the county who made the decision to flip all the leads. Thank you, Jason. And not only that, but be confident enough to say, okay, nothing is on in their normal orientation, but this looks like a STEMI, and call the hospital and put it in motion and save that time that is so precious, because you do have a limited amount of time when you've got your left coronary artery is occluded. That supplies a big old hunk of the heart, and so each second that's blocked, that's heart muscle that's got potential to die, and that can't regenerate more of that. So pretty amazing that 1 in a million plus a heart attack plus our crew plus the right decisions. There's way too much. Too much math there, too small of a number. Just really amazing. And the best part, taking it back, is it's us taking care of the people in the community, which is, I think, I hope I can speak for all y'all, myself. That's why we do what we do. So all the numbers and the fancy medical stuff aside, we've got to take care of one of our own. It's pretty awesome. Thank you.
Define a kind of, Doc, STEMI, kind of define a STEMI.
So yes.
Hang on a second, Let me get, okay, go ahead.
Yeah, so heart attack, when we talk about heart attack in lay terms, we have blood flow that supply the muscle of the heart. And if the blood vessels that supply that heart are blocked, then that is a heart attack. Sometimes heart attacks can occur that we can see evidence of on the EKG. The EKG is basically an electrical picture of the heart muscle activity. Sometimes heart attacks don't show up on EKGs, some do. About 65 to 70% show up on EKGs. Thankfully, in this case, Jason and Nicholas were able to see that on the EKG, and basically from the parking lot there where y'all were, call ahead to the hospital, to HCA Conroe, and alert the cardiologist, the cath lab team, the ER, all the folks in the hospital that, hey, we're bringing what we call a STEMI, or an ST elevation MI. That's the sort of the jargon for we see a heart attack on the EKG on our electrical picture. And so all the skids were greased for Mr. Hoyle to roll right through the ER, the cardiologist to see him there, and all the medications that we give to prepare somebody to go to the cath lab were all given. Everybody was watching their clock, moving things along quickly, and then we went to see the plumber. Do they go through your wrist or through your groin? Groin. So they go in through the groin, they pass the wire into the heart blood vessels, they inject dye and look to see where the dye stops flowing. That's where the blockage is. And they pass what amounts to a tube through that blockage, open it up, and that's what we call a stent. That stents open the artery and allows blood to flow past where that blockage was back to normal. Now, the hard part about Mr. Hoyle was that all of that vasculature and all of that anatomy wasn't on the left side of the body where the heart normally is. It was on the right side. So all of those angles and those entry points and those directional changes that the cardiologist has to make were mirror backwards. And so he's doing that, Dr. Romanini's doing that with an X-ray guided, what's called a fluoroscopy machine. And so to make those twists and turns when everything is flipped is even more difficult. But thankfully we knew that, he knew that, was able to at least navigate to where we hoped the big blockage was, and thankfully we were right. So that's why y'all are here today. So pretty awesome. Yeah. So thank you all. Thanks everybody.
Okay, when you get outside, come and run that down. Go ahead.
So I still thought I was heartburn or indigestion, and I was thinking to myself, if I burp or pass gas and this goes away, I'm going to be so embarrassed. But it just kept, the pain in my chest was so bad, and to the point where, I mean, they kept telling me, we need you to sit still so we can get a good reading. And I'm like, I'm not in control of it, dude. Like, my body is just reacting right now. I can't, I'll do my best. And I just, being that, the fear of, oh my gosh. But when I was talking to the doctor on the cath lab table, and I said, so am I gonna have to take heart medications now? And he said, well, Mr. Hoyle, you just had a major heart attack. What do you think? And I was like, so it was a heart attack? And he said, yeah. He said, when it comes to heart attack, it's the worst one you could have had. So I was like, and immediately I thought Widowmaker. So I was like, wow. So, and I remember still, at that point I was still hurting, but the medications they had given me had got me to calm down, but I could still feel that pain. And he asked me a couple more questions. I don't remember, we were kind of talking, and in the middle of answering one of his questions, I realized, hey, that pain's gone. So apparently, I don't know if it was like right when he put the stent in, because like I said, I figured I would feel something, this thing going all the way up into my heart. I would feel something. I didn't feel a thing. I didn't feel it at all. So I don't know if it was right as the stents were put in, or if it, once he put them in and then the blood started flowing and the heart calmed down, then the pain went away. I really don't know. But
You get a shot of that deal on your neck there, though. Hang on a second. I'll get it protected. Well, that looks good.